You know, Andrea, in my office, I found something. Do you know what this is?
Yes, of course. This is the Rinderpest vigilance cow. It still says OAH, so it's super
yes.
old.
And you know that Rinderpest was at the origin of the creation of OAH.
Hello, I'm Andrea. I'm a veterinarian working here at WOAH as an animal health information officer.
Hello, I am Jean-Luc. I am a former DDG of WOAH.
Thank you for joining us today, Jean-Luc. Today we're going to talk about the past, the present, and we're also going to take some time to talk about the future, how we envision the future of veterinary medicine and the animal health sector and what's the role of WOAH. So thank you for being here.
Thank you very much, Andrea, to have this opportunity to exchange with you about the future of WOAH.
So to begin, I want to propose a short dynamic. I would like you to think about your time here in WOAH, when you were working here at headquarters, your day-to-day, and try to reflect and maybe share with us a few things that you've noticed have changed since you were here compared to now.
For example, I remember the change of the governance and the organization of WOAH, and also the growth of the staff and the change of the information system on the status and after WAIS and WIDE. What about you?
I joined more recently in September 2019. I've been here for a bit over 4 years and I've seen some changes happening. I think the one we can all relate to is the one imposed by the COVID pandemic, which is the working from home policy. When I first joined, the working from home policy I think was not on the table, and I think just the environment here where we were all at the office at headquarters, we were so fruitful, having this great team of international people from many countries. So that was not on discussion, but then obviously we had to adapt. And before the COVID pandemic, we had a big transportation strike. I don't know if you remember, here in Paris in December 2019. So we had to adapt and adopt this teleworking policy. And then so when the COVID pandemic started, we were already ready. That's something that was a big change that really impacted the way we work. And another big change that I've seen and everybody has seen is the change of name. For those who don't know, the World Organization for Animal Health, we know it now as WOAH, was the OAI. You knew it as OAI, the Office International des Épisodies, if I remember correctly.
Yes, exactly.
So that's been a big change, not only the acronym, but the whole visual identity, everything has changed. Some of us struggle to adopt, especially the ones that joined when it was OAI. But yeah, it's a change we've started to embrace, and it's there to stay.
You know, Andrea, in my office, I found something. Do you know what this is?
Yes, of course. This is the Rinderpest vigilance cow. It still says OAH, so it's super
yes.
old. I think it was done in the context of a Rinderpest campaign,
yes,
communication campaign, and Rinderpest, of course, you know, it's eradicated. It's a cattle disease.
And you know that Rinderpest was at the origin of the creation of OAH.
Yes, I know. Thanks. Thanks for bringing this.
Thank you very much. You know, Andrea, that OAH was created to ensure the transparency of the information of animal health situation. And after, WOAH was recognized as a reference organization by WTO, the World Trade Organization, because WOAH create standards for the trade of animals and animal products, as Codex Alimentarius for food safety and IPPC for plant health. But collecting information is part of your daily work, no?
Yes, indeed. I work with our World Animal Health Information System, also known as WAHIS. You mentioned it before. So what we do in our team as part of the work we do here at headquarters is collecting information on animal diseases that happen around the world. And actually countries send us this information through this system, through this WAHIS. They send the information, we receive it here at headquarters. We do verification process with the information, and then we publish it. So not only decision makers in terms of international trade, but also researchers, veterinarians around the world. The media also consults this system. And something that I really find fascinating about this work is the way we communicate with the countries. We're here based in Paris, of course, but just the way we reach out to the countries. And nowadays we know WAHIS as this online platform, right? Where the countries really take minutes to fill in the reports and submit them to the same day that something occurs, and then we receive them the same day. We verify the reports and publish them, and it's so easy and so fast to do it. Even if we need to communicate with the countries, we just call them via the phone, and nowadays a Zoom call, it's very easy to just exchange in a very timely manner. But when I think about how this might have changed over time, it's really interesting to know how the communication channels have evolved in the last 100 years. And I was actually preparing this presentation for some master students where I had to tell them how the communication have evolved and how we've been collecting this data over the years. And I actually found this. I was looking into the archives and I found a fax. And you know what's the most interesting fact about this fax is that the organization was so small that everybody could really have access to this. And I actually saw your name. So you were probably informed.
My signature.
And your signature, yes. So yeah, this is really, for someone of my generation, this is something I never used, right, to communicate. Now we use the phone. And I'm sure before the fax, there was other ways of communicating with the countries, because we're talking about the 20s.
The way of exchanging information has really evolved, and fortunately, because we use now the new technologies. Mm-hmm. And before that, before the fax, there were the telegrams.
Yes, I heard, I saw photos, but I've never actually held one in my hands. And I assume it was taking longer to arrive, you know, the information that was sent from the countries, yes. It was taking a long time to arrive to headquarters.
And also the surveillance system, the diagnosis, and the organization of veterinary services in order to fight against animal diseases are very important, and we have to invest in surveillance and diagnosis.
Mm-hmm. And we're actually right now working to improve this reporting system. But we've talked about what I do. I would be interested to know what you were doing here in WOAH.
Under the leadership of the new DG at this time, Bernard Valla, the organization changed the format. Mm-hmm. And before it was a club of veterinarians, not very visible. And after it became an organization speaking with other organizations like as FAO, WHO, and other international organizations. And I was particularly responsible of the modernization of the governance of the organization and also the regional affairs, okay. Because the regional representation are very important. And I had also to manage the new membership of countries, as China, for example. And it was also necessary at this time to develop the communication. You remember that in 2005, 2006, there was the first crisis of avian flu, and we developed the communication around avian flu in order to strengthen the veterinary services. It was the beginning of the tripartite alliance, WOAH, FAO and WHO, and now it's the quadripartite alliance after the COVID crisis with the incorporation of UNEP.
That's actually a very interesting work that you did. And when we think about veterinarians, we don't often think about working in this international setting, right? We were often trained to work on the field or maybe in a medical setting, but we don't really think about this key work that we do at the international level, which is so important, right? To share this knowledge and this work with the rest of the world and the rest of the professions as well. I would be also interested to know how this has played a role in the current position that you hold and what you do nowadays.
International experience is fundamental to have a global vision of the themes, particularly the field of health and trade. And the knowledge of the organization has served me as a delegate of my country to WOAH, and also served me now as president of one of the committee of the Codex Alimentarius organization sister.
And I think us as veterinarians working in public health, we know about our role in society more than anyone else. I think it's become more evident given latest events like the COVID pandemic, and these public health emergencies really highlight what our role is within society and not only within the animal health sector. I think one of the most relevant memories that I have from the beginning of the public health emergency was how the veterinary sector was really contributing to testing at the time, and how the contribution from this sector really unfolded over time, and how really the public started acknowledging really our role in emergencies like this.
You know that veterinary services are considered as a global public good, and we have to invest in veterinary services. It's very important also to have a good representation of all the regions of the world, and there is a need of inclusiveness, and also a need of partnership between all the actors, private and public actors, and we have also to develop the international cooperation on the solidarity to help the countries in difficulty. And what is also very important is that we can consider that WOAH is a facilitator of multilateralism, and therefore WOAH has a role in geopolitics.
Yes, exactly, and I think that's really one of the core components of the organization, because when we think about WOAH, we often think about data collection in terms of animal diseases, right? But I think if I had to share something that has been or has remained as the essence of the organization, has been the scientific expertise that we rely on really for developing these standards and these guidelines that we set for the countries, and how we build on the network of experts that we have to really build on this latest scientific knowledge to produce these guidelines. And I think that can only come from 100 years of experience.
And we have also to highlight the role of the laboratories and the collaborating center to be sure to have standards based on the latest scientific knowledge.
Yeah, and I think that remains our core component, and the thing that we are really recognized for as an international standard setting body. This has been a really interesting discussion. We've talked about the past and the present and what we do right now, but what about the future? What do you see in the next 100 years of WOAH? What would you like to see?
For the 100 next years, we have to face a lot of challenges, the climate change, the need for food, also the emerging diseases. It's very important for WOAH to deal with more integrative approach in order to work with all the disciplines and all the sectors, and to have a very global and integrative approach to fight against the diseases.
Yes, and indeed, linking back to the rinderpest cow, we can think about how the organization was founded and what the challenges at the time were, where we were facing this big cattle epidemic. And now, 100 years later, we are facing new challenges and different challenges as well. And I have already seen how this socioeconomic lens has been shifting towards this more multidisciplinary approach that we know nowadays as One Health, and how we start to talk about these global challenges and how we can tackle them, one of them being climate change, of course, and really putting these topics on the table to start reflecting on how we're going to deal with them, not only adapting to the challenges, but also thinking about our sector as potential contributors to the challenge and how we can work to mitigate these potential contributions.
And WOAH must follow also the new technologies and also the transition in livestock and the production of food, and it's a very big challenge for the next years.
Yes, indeed. I think we have to think about how we merge those two together, right? The emerging challenges and the socioeconomic factors that always drove our work. That's been really exciting. I really hope that in the future we can continue to adapt to the new challenges and really continue our work. Thank you for being here.
Thank you very much, Andrea. It was very interesting to discuss with you about the past and the present of WOAH, but especially on the future of WOAH, because it's a big challenge for the organization and the world.
Yes.
And happy birthday to WOAH.
Yes, 100 years. It's been a long time. I hope it continues for another 100 years. Thank you, and bye.
Thank you. Goodbye.